Hello and welcome. Today, we'll be diving into Detrusor underactivity, a bladder condition that affects how well you empty your bladder. We'll explore what causes it, how it works, the symptoms to watch out for, and what can be done about it. So, what leads to Detrusor underactivity? There's often no single cause, but it can arise from several factors. Neurological conditions like stroke, multiple sclerosis, Parkinson's disease, or spinal cord injuries can the nerve signals that disrupt control bladder muscle contractions. Diabetes, with its potential for nerve damage, is another contributing factor. Certain medications, especially those with anticholinergic properties, can inhibit bladder contractions. Chronic bladder outlet obstruction, such as from an enlarged prostate, can weaken the detrusor muscle over time, and sometimes the cause remains unknown, termed idiopathic detrusor underactivity. To understand detrusor underactivity, we need to understand how the bladder works normally. The detrusor muscle, the bladder wall, contracts to push urine out. This contraction is carefully controlled by the nervous system. In detrusor underactivity, this control is impaired. Either the nerves don't send the right signals, or the detrusor muscle itself is weakened and can't contract forcefully enough. This results in incomplete bladder emptying and a buildup of residual urine. It's tricky to pinpoint the exact prevalence of detrusor underactivity because it often goes undiagnosed or is misdiagnosed as overactive bladder. It's believed to be more common in older adults, particularly men, due to the increased prevalence of conditions like diabetes, prostate enlargement, and neurological disorders. However, it can affect people of any age and gender. The symptoms of detrusor underactivity can be quite disruptive. A primary symptom is a weak or slow urinary stream. You might find yourself straining to urinate or experiencing hesitancy, a delay in starting the flow. Another common complaint is incomplete bladder emptying, leading to a feeling that you still need to go even after you've just finished. This can result in frequent urination, including nocturia or nighttime urination. In severe cases, it can lead to urinary retention, a painful inability to pass urine. Diagnosing detrusor underactivity involves a thorough evaluation. Your doctor will start with a detailed medical history and physical exam. A post-void residual urine test measures the amount of urine left in your bladder after urination. Uroflowmetry measures the speed and volume of your urine flow. Cystometry, a more specialized test, measures bladder pressure during filling and emptying. This helps determine the strength of detrusor muscle contractions and identifies any nerve or muscle problems. In some cases, electromyography, or EMG, may be used to assess the electrical activity of the bladder muscles and nerves. While there aren't strict classifications or distinct types of detrusor underactivity, it's often categorized based on the underlying cause, such as neurogenic, myogenic, or idiopathic. Neurogenic refers to nerve damage, myogenic to muscle damage, and idiopathic to unknown cause. The severity can also be graded based on symptoms and aerodynamic findings. The severity would indicate the level of intervention needed, from mild behavioral changes to more invasive treatments. Treatment and management of detrusor underactivity aim to improve bladder emptying and reduce complications. Intermittent self-catheterization, where you regularly insert a catheter to drain your bladder, is a common and effective method for ensuring complete emptying. Medications, such as bethanacal, can theoretically stimulate detrusor muscle contractions, but their effectiveness is limited and they have significant side effects. Bladder training exercises might help improve bladder awareness and control. If bladder outlet obstruction is present, addressing that issue, such as with surgery for an enlarged prostate, can improve bladder emptying. Neuromodulation techniques, such as sacral nerve stimulation, can help improve nerve function. Unfortunately, there's no guaranteed way to completely prevent detrusor underactivity, especially when it's related to underlying medical conditions. However, managing risk factors can help. Controlling diabetes through diet and medication can reduce the risk of nerve damage. Prompt treatment of bladder outlet obstruction can prevent weakening of the detrusor muscle. Regular exercise and a healthy lifestyle can contribute to overall nerve and muscle health. And being mindful of the potential sides of medications that can affect bladder function is also wise. The prognosis for detrusor underactivity varies depending on the underlying cause and severity. With appropriate management, many individuals can achieve significant improvement in their symptoms and quality of life. Intermittent self-catheterization, while requiring commitment, can be a very effective long-term solution. Researchers continue to explore new treatments and technologies, including advanced neuromodulation techniques and regenerative medicine approaches to repair damaged bladder muscles. Gene therapy is also being researched as a future option to restore nerve function. Early diagnosis and intervention are key to preventing complications like urinary tract infections and kidney damage.